Hi, my fellow Indians, ladies and gentlemen. I'm Dr. Muhammad Zawahir. I'm a practicing surgeon in New York City. I'm here to speak to you on the current corona situation in India. Today, we have achieved the dubious distinction of being the number one country most afflicted with the coronavirus. We have a lot of people to blame for this tragedy. As you all know, when this disease hit the world in January of 2020, all of the nations, including the most resourceful and affluent nations, were totally surprised by the onslaught of the disease and paid the price in unprecedented number of fatalities. They were caught without the resources to meet the demands of this disease. However, all of them learned quickly and effectively by rising to the occasion. They also heeded the warnings so vehemently put forth by scientists all over the world that a second wave and maybe a third wave is in store and probably more virulent than the first. But India, on the other hand, did not heed that warning. In the first wave, while India had considered, while India had considerable number of infections, the death rates were relatively low, leading to a false sense of security. That is my excuse for the public, but there was no such excuse for how the government conducted its affairs, for falsely touting themselves as being an example to the rest of the world in controlling the pandemic. My purpose here is not to demonize anyone, but offer solutions to the problem by advocating remedies to save lives and to actively work towards limiting and ultimately banishing this disease from the face of the earth. At the first instance, I would like to get all of you to agree that COVID is a definite disease and not a figment of the imagination or a conspiracy by some people or countries, as some rumors would have us believe. The number of bodies piled up should leave no one to doubt the veracity of the existence of COVID. Secondly, I wish to make you aware that we have no specific medicine or medicines to kill the virus as we have in the form of antibiotics for, say, other diseases like tuberculosis, typhoid fever, or pneumonia, etc., etc. At this point, I would like to explain to you how this disease spreads from one person to another. Understanding this is very important to follow preventive measures that I am going to insist on. When a person has the infection and therefore harbors the virus, when he coughs or sneezes or talks loud, his breath carries the viruses out in the form of minute fluid particles. That is, it flies out of the mouth or the nose like a steam, and depending on the force of the breath, these particles can be in the air for a few feet or more. The best example I can give you is a hairspray can. When it's pressed, the spray comes at you. When this spray of viruses encounters a person without a mask, that person unwittingly breathes in the spray of viruses. The viruses reach the nostrils and then get carried to the lungs. That is where they attack the lungs and produce the disease, which consists of destroying lung tissue and collecting debris and fluid. The end result is to reduce the capacity of the person's breathing to varying levels of severity. Those of you who are familiar with people who have had this disease, you would know that doctors state the severity by a CT scan and express it in numbers ranging from 1 to 40, where 1 is the least affected and 40s most severely affected. In workable terms, if the score is, say, less than 20, we have a mild case. As the numbers go up, the disease process is more severe. As it gets closer to 40, the outcome is ominous. What you will see in the patient is as more and more lung tissues are compromised, he is going to have varying degrees of difficulty in breathing, needing nasal oxygen in the beginning, and if it gets worse, they have to be put on a respirator and machine assisted breathing. Even at this point, he can still survive. As I said earlier, we have no specific medicine to kill the virus. The only medicine that can kill the virus is an antibody cocktail known as remdesivir. This is in very short supply because it cannot be mass produced and very costly, and certainly cannot satisfy our needs. If it is available, certainly it should be given, certainly as a first step. Beyond that, and in most cases, what the patient is going to get is supportive treatment in the form of oxygen or ventilator, steroids, and taking care of other conditions that might coexist in the patient. He might have a blood pressure problem or diabetes or heart problems. All of these have to be handled. He has to have adequate nutrition as well as fluid control and fluid replenishment. In many cases, the patients need respiratory physiotherapy to get the phlegm out so that it does not further compromise the capacity to breathe. Having described how the disease progresses, now I can get to the vaccination. Since the tail end of 2020, we were fortunate to have the vaccines available for widespread administration. This is a phenomenal achievement on the part of the scientists and the pharmaceutical industry. It has never been done, a vaccine within a year. Most vaccines take about 3 to 5 years to get formulated and produced. In India, we have the Covishield, produced by the Serum Institute, and Covaxin, produced by Bharat-BioNTech, both of them being Indian companies. Both of them have success rates beyond 80%. Serum Institute, based in Pune, by the way, happens to be the largest vaccine producing facility in the world. To these two, we have now added the Russian vaccine, not so strangely called the Sputnik 5. All three vaccines are proven by extensive testing to be 80% or more effective. Now, how do vaccines work and how do they help us? All vaccines are the ultimate weapons in the fight against disease-causing germs. The body, I'm sorry, when you receive the vaccine, it evokes a reaction in the body to produce antibodies against the specific germ for which it was intended. It is similar to an army waiting for the enemy to enter. When the virus enters the body of a vaccinated person, the antibodies target the invading viruses and destroy them before the virus takes root and causes symptoms. When a vaccinated person encounters the COVID infection, he is either going to not suffer from the illness or may have mild symptoms. We have had a tremendous amount of fake news attesting to how bad the vaccines have been and the large number of deaths they have caused. My dear friends, let me tell you that these statements are wildly exaggerated. Like any other vaccine or medications, we do see untoward side effects from the vaccine. Let me explain to you what happens after the injection of the vaccine. Locally, you may experience pain or swelling at the injection site. You may have some allergic reactions by skin itching and so on and so forth. Subsequently, people experience some side effects like fever, chills, tiredness, body aches, nausea, or headaches. In the majority of cases, none of these symptoms occur. When you receive the injection, you are advised to stay at the hospital or clinic where you got the injection for 15 minutes before leaving. I would even advise you to stay a half hour, just in case if you have any problems. Very few had serious side effects, but when you consider the millions of vaccinations dispensed across the world, the untoward side effects have added up to a minuscule few. To deny yourself the tremendous benefits of a vaccination based on those few events is unjustified and certainly unrealistic. Now, right now in India, we have a tremendous shortage of vaccines because they were shipped elsewhere. The government has rightly corrected that ill-advised step, and soon more vaccines will become available. I'm here to plead with you and plead fervently to take the vaccines when they become available. They are our only salvation to become free from this scourge. Our entire population of 1.8 billion being vaccinated will ultimately give us freedom from masks and let us go back to how we were before this tragedy laid siege. The process of complete vaccination of this nation may probably take a year or even more at the rate we are proceeding. Now, in the meantime, while the vaccinations are going on, we have a pretty effective armamentarium of proven and effective measures against this virus. First and foremost, universal masking. When you get a mask, please get a mask like the N95. This is an N95 mask that I'm going to show you. This has the best fit against the nose and the mouth. N95. Okay. There are others masks like surgeons wear surgical masks. You can wear them too, but N95 is the best. When you wear a mask, wear it properly, covering at all times the nose and the mouth. I look at so many pictures from India. I see so many people with their masks below the nose. They wear it. They put it like this. This is no good. It is not doing anything. It is not doing anything. You might as well not wear them at all. When you are at home with your family, you do not need to wear the mask. But when other people come into your house or when you go out, the mask is a must. Is a must. When people come into your house and they don't have a mask, please tell them you either have to wear a mask or I'll give you a mask. And when you go out or when you at home, you meet and interact with people, make sure that you are about 6 feet apart from them. 6 feet is about 2 meters. My own advice is, unless you have an absolute need to meet with others, avoid it. There is no reason. There is no reason. That is what I call a sacrifice. These are sacrifices you have to make in order to defeat this virus. Today, anything can be accomplished through a cheap WhatsApp call. You can put other people online. 3 or 4 people can be on the same phone speaking to each other. So there's no need to meet. Please avoid going into crowded places. You cannot distance yourself in a crowd. Crowded situations are many and include parties within the house, outside of the house, friends' houses, or family gatherings, weddings, political rallies, and of course, religious gatherings like masjids, temples, or churches. To this, I will add travel, be it in buses, trains, or planes. They are the ultimate venues to get the infections easily. Yes, I do realize people must go out to work. Workers and employees have to work together to afford safe working conditions. All of the preventive tenets that I have talked about, like proper masking, distancing, hygienic activities, must be followed. On returning home from work, you should change clothes and shower before mingling with the rest of the family. In the final analysis, all the above precautions are meant to protect yourself, protect your family, and the community at large. I've taken a lot of your time to explain and make you understand so that you realize and follow the instructions and precautions. And you know why those precautions are taken. My friends, this is war. This is actually a war against an invisible, wily enemy. Wily? Why? Because it keeps changing, mutating, and changing its structure. Science has done its part admirably. Governments will ultimately do their part. But we are the foot soldiers on the ground, on whose shoulders lie the ultimate burden. We have to show courage, fortitude, patience, and above all, sacrifices to overcome this disaster. We don't have a choice. We must win. So let us go forward and first get the vaccines and prevail upon the hesitant ones to get the vaccines for your safety as well as other people's safety. And you have to stay out of the path of the virus by wearing the mask, by distancing yourself, and avoiding gatherings. I wish you good luck and God bless. Thank you.